I think that there's a lot that I wish people knew better, like in terms of seeing some success, like small successes being huge success, seeing people change, seeing people being able to reunite with their families, start schools, start jobs, like understanding that this is not it's not as dark as people think it will be, you know, and you can set boundaries, you can, you know, protect yourself, and how do we support people while they're getting better? Because we know that that also works, right? We know more now that this punitive approach, this idea of, you know what I mean, suffering through DTs and, you know what I mean, in a makeshift detox back in the day, that doesn't necessarily work. If the punitive approach worked, we would have seen results by now. I'd like to think I'm very authentic with people, and I like to think of it a little bit, you know, in a sense, it's almost like a little bit of reparenting in some ways, that, you know, is the unconditional regard for people, that they are trying the best that they can with the information that they have, and they're also, you know, when people, you know, calling or challenging people in the right ways to sort of, you know what I mean, help them see the behavior for what it is, that I think that that's a really important piece. We have a lot of things that are going on. It's a bit of a perfect storm, I think, in the city, at least in Toronto. We have no housing, we have lack of services, our emergency rooms, which are all, you know, at overcapacity to begin with, let alone now we're seeing huge surges of, you know, fentanyl coming into the system. I think that's partially why it's been in the works for a long time, from what I understand, with this opioid, you know, epidemic, with the drug companies, with, you know, changing OxyContin, and then the changes have trickled down, and now the black market sort of filling in. So I definitely think we're seeing more of it because of that, but I do think we don't have a national, well, we're working on a national housing strategy, but people are, you know, we don't have places for people to go. We don't have places for people to access services promptly. We don't have safe housing, so I think that is a bit of a storm. Housing would make a huge difference for people, because, you know, as much as this idea that, you know, living in a boarding house with, you know what I mean, 20 other people who are all like smoking crack or using, you know, various illicit substances, the idea that that's a great environment for people to change is just, you know, just blows my mind a little bit. People, they're already picking up on part of your judgment because they already feel it themselves. So it's like being able to display as authentic and genuine of an understanding as you have for yourself towards them. I think the idea of having more empathy and having more that this isn't, I might not know what it's like to use cocaine, you know, but I might also understand what it's like to avoid or to not be able to manage my stress. It's to bring more empathy that these people are struggling the same ways we are in our own lives to one degree or another, that I think would create a little bit more of equitable care. Our healthcare system is a little broken right now. When I say broken, I don't think that can't be fixed. I think we need to all acknowledge it's a bit broken right now for us to fix it. Number one, we have an access problem with just sheer volume that are pouring into our emergency rooms. We're having more people who are desperate and in crisis, which puts a huge strain we weren't prepared for it. Obviously some funding into the healthcare, into emergency services especially. We know that when you capture somebody at a moment of motivation where they are ready to make a change, that moment can be very fleeting, but yet it's very powerful. And the idea that we miss that all the time when someone's sort of like, I'm ready to try this.